Hello students, welcome to my channel Dr. X Pathology Pearls. Here we simplify tough exam topics into easy to remember concepts for MBBS students. Let's start. Today we learn the difference between ulcerative colitis and Crohn's disease. Now this is a very important topic from the exam point of view, but we learn it in a very simple manner. So the first point of difference is the site. In ulcerative colitis, this starts in the rectum, spreads proximally in a continuous manner limited to the colon, whereas in Crohn's disease, this involves any part of the GIT from mouth to anus, most commonly in the ileocecal region, and this shows skip lesions. So the important point to remember here is, here there will be continuous manner, here there will be skip lesions. Okay. Now, the second point is the extent of involvement. In ulcerative colitis, only the mucosa and submucosa are involved, whereas in Crohn's disease, there is the entire full thickness of the mucosa is involved. That is, there is transmural involvement. Now, the pattern of involvement. Ulcerative colitis will show continuous diffuse lesions, whereas in Crohn's disease, you will see skip lesions. That means patchy with normal areas in between. Now coming to the gross appearance. In ulcerative colitis, as we already have seen that there will be diffuse continuous disease, there will be mucosal granulations, broad-based ulcers, pseudopolyps, mucosal atrophy in long-standing cases. Whereas in Crohn's disease, there will be serous involvement, cobblestone mucosa, fissures, strictures, creeping fat along the mesentery. Now microscopically, what will you see in case of ulcerative colitis? Here we will see crypt abscesses, mucosal ulcerations, and the most important point, there will be no granulomas. Now in case of Crohn's disease, you will see transmural chronic inflammation, lymphoid aggregates, and the most important point is, in 35 to 50% of cases, there will be non-caseating granulomas. So the basic difference between these two will be no granulomas here, whereas non-caseating granulomas are present in Crohn's disease. Now complications. In case of ulcerative colitis, there can be toxic megacolon, massive hemorrhage, dysplasia, and high risk of colorectal carcinoma. Whereas in case of Crohn's disease, there will be strictures, fistulae, obstruction, and malabsorption. Now coming to the next point of difference, that is extraintestinal manifestations. In ulcerative colitis, the most important one is PSC, that is primary sclerosing cholangitis, and others are arthritis and skin lesions. Now the most important in Crohn's disease, there will be perianal fistulas, and others are erythema nodosum, gallstones, and renal calculi. Last but not the least difference between the two, that is in case of ulcerative colitis, smoking has a protective effect, and in case of Crohn's disease, smoking is a risk factor. Now with this we complete the difference between ulcerative colitis and Crohn's disease. Now quickly revise the most important points from the exam point of view. See, continuous versus skip lesions, mucosal versus transmural involvement, and no granulomas in ulcerative colitis, and presence of granulomas in Crohn's disease. And the risk of cancer is higher in ulcerative colitis than in Crohn's disease. Now just remember UC, ulcerative colitis. Now this U stands for ulcer, and this C stands for continuous, C stands for colon, and C stands for carcinoma risk. Now in case of CD, that is Crohn's disease, the C stands for cobblestone, the C stands for Crohn's, and again C complications are fistula and stricture. With this, we complete the difference between ulcerative colitis and Crohn's disease. This is a quick revision, okay, and this is very important from exam point of view. This is an exam favorite, so please save my video so that you can revise before your exam, and don't forget to subscribe my channel for more quick pathology revision. Remember, a small consistent revision makes a big difference. Please comment and let me know if you want me to prepare any particular exam-oriented topic for you. So please like, share and subscribe my video. Thank you for watching.